To investigate skeletal anatomy, we're going to start with a quick overview of all the bones in the body. So here we have the skull, very complex bone. We're going to have a separate video on it alone in just a little bit. But so that we can see some of the other bones, we will just lift that right off. And we can now see some of our vertebrae or backbones. You'll notice that the vertebrae go all the way from the base of the skull down to the tip of the pelvis here. So we have our cervical vertebrae, 7 of those. Thoracic vertebrae and the associated ribs, 12 of those. Lumbar vertebrae, 5 of those. And generally 5 fused sacral vertebrae right here. And our tailbone, or coccyx, just hanging out at the very end of the vertebral column. Now here we can see a small little bone. I'll turn this sideways. This is called the hyoid bone. And this model is not exactly accurate because it's not connected to any bone in the body directly. Rather, it's held up by ligaments and muscles. Once again, our hyoid bone, just here. Turning to the front, the breastbone is more properly known as the sternum. And if we're going to get really crazy, we actually have it broken into 3 separate bones. The manubrium, the sternal body, and the xiphoid process, which tends to be cartilage, but ossifies or turns into bone with age. Extending from the vertebral column and connecting it to the sternum, we have our ribs. 12 of those. They each have distinctive features, but we won't worry about those just now. But note, they tend to connect to the sternum, not directly, but through costal cartilages. So slightly softer, more maneuverable cartilage connecting bone to bone. And here, the ribs, 8, 9, 10, connect to the cartilage of the rib above them, whereas what we call our floating ribs, ribs 11 and 12, don't connect with anything. They have a little tip of cartilage usually here, but they don't connect to any of their neighbors. Moving into the upper limb, we have our clavicle or collarbone. And, bit of trivia, it's the most frequently fractured bone in the body, and it is the only bony connection our upper limb has to the rest of our skeleton, because the clavicle connects to our scapula, this mostly triangular shaped bone here, which then articulates with the humerus. So we have the humerus here articulating at the glenohumeral joint, and then the humerus continues inferiorly. You have its head, shaft, and then this area here is where it articulates with the forearm bones. We have 2 of those, the radius and the ulna. And in addition to flexing, the radius and ulna are able to rotate in this manner, called supination and pronation. Now so moving from the radius and ulna, we get our carpal bones, or bones of the wrist. There are 8 of those, and then we move into our hand proper. These bones are called metacarpals. So we have carpals at the wrist, metacarpals in the hand, and then the actual bones of our fingers are called phalanges. So we have 2 of those for our thumb, but 3 for all the other digits. Now returning to the vertebral column, we're now going to look at our pelvis. We can see that the sacrum, this big fused vertebra here, connects with our hip bone. The hip bone, also called the os coxa, is actually made of 3 fused bones. The big wing here is part of our ilium. This more posterior part is called the ischium, and the more anterior part here is called the pubic bone. They all fuse, and one of the places where they fuse is here at this big crater. That's called the acetabulum, and the acetabulum is where it articulates with the head of the femur. So now we have our femur bone, the largest bone in the body. Our femur bone has these large bumps on it called trochanters, because the bigger the bump, the larger the muscle attachment that's occurring there. We have the head, neck, and shaft of the femur, and then heading down here, we have the articular surface where it articulates with our tibia. But before we get to the tibia, let's note this little guy. This is our kneecap, or patella. And it is not attached to the femur, unlike in this model, but floats inside the muscles and tendons that cross the knee in this area. Moving down to our leg proper, from the thigh to the leg, we have the tibia here, big, large, expanded portion superiorly, and comes down here, supports most of our weight, but it has a buddy called the fibula. Now, tibia and fibula right there. And we have the head of the fibula there. And this area down here where our ankle is, lateral malleolus, and this is the medial malleolus. And they're part of our ankle that holds these other bones in place. And these are our tarsal bones. So up in the hand we had carpals. Here in the foot we have tarsal bones. And several of those, one's the calcaneus, that's going to be our heel bone, along with several others. And then, just like before, if we have tarsals here, we have metatarsals here. And going down into the toes, we have, once again, phalanges. 2 for the big toe, and 3 for the other toes. And that is a quick run-through of skeletal anatomy, and we'll go into a little more detail on the individual bones as we proceed. We'll now take a closer look at the vertebra. So once again, from top to bottom, we have our 7 cervical, 12 thoracic, 5 lumbar, and sacral vertebra here, along with the coccyx or tailbone. Now, one thing about this presentation is it's actually wrong, because we're just showing the bones. In real life, there are connective tissue discs in between each of these vertebrae, except for the sacrum and the top between the first and second cervical. But generally we have intervertebral discs here to help absorb some of the shock and limit some of the motion that these bones undergo, because in addition to supporting the weight of the body, they're also protecting the spinal cord. So here, let's take a quick look posteriorly, and we can see it looks very different on this side. And we're going to investigate each of these regions in a little bit more specificity. But first, we'll scooch this up. We're just going to look at an individual vertebra to get a sense of what the structures of these individual bones are. So this is enough stuff. It's very easy to spot the large body of the vertebra here. This is the area that's going to support most of our weight. It's the largest, most stable. From there, we have what's called our spinal or neural arch. And we have a pedicle connecting the arch to the body. We have a lamina connecting it from side to side posteriorly. And coming off between the pedicle and the lamina, we have a transverse process. You can see that on both sides. So 2 of those. And between the 2 laminae, we have a single spinous process. And you notice they enclose the spinal canal. That's where spinal cord and nerves are going to be. Also, near the transverse process, we have some little struts of bone sticking superiorly and inferiorly. These are the articular processes, and these are where the vertebrae actually connect to their neighbors. So this process will articulate with the process from the vertebra below it, and this process will articulate with the process from the vertebra above it. Now that we've seen the vertebral column, we're going to take a look at representative bones from each area. So we have our sacral, lumbar, thoracic, and along with the thoracic vertebra, we've got our rib, and then our cervical region here. So we'll start at the bottom and move upwards and go to our sacrum. So let's pull that in here. So the sacrum, as you'll note, articulates with the lumbar vertebrae up here, and it's going to have its only articular surface here, where it articulates with the 5th lumbar vertebra. The spinous processes and vertebral bodies of the sacrum can still be noted, but since all these vertebrae are fused, they're all connected to each other, and we have a median sacral crest instead of individual spinous processes, and a lateral sacral crest instead of individual transverse processes. Now, because the sacrum forms a continuous cover here, we have what's called the sacral canal, where these spinal roots are, and it opens up here at the sacral hiatus. And that is a place we can actually access the spinal canal if we need to. Little bumps on either side are called cornua. They're a nice little landmark. And on the posterior side here, we can see openings for the posterior branches of the nerves, the spinal nerves that are coming out. So we have a posterior foramina here, and we have anterior foramina on the anterior side. Now right here, this very expanded lateral part of the sacrum is sometimes called the ala, or wing, and it's going to be where we articulate with the hip bone, or the ilium in particular. So right here we have the auricular surface, A-U-R, auricular, because it looks kind of ear-shaped. Have one of those on each side. And then we'll move on to our lumbar vertebra. Now the lumbar vertebra is the one we looked at before. It shares many features with most other vertebrae. So the thing to note about the lumbar vertebra is that they have very large vertebral bodies. These are somewhat square spinous processes here, and fairly broad and long transverse processes. So that's the main characteristics that you're going to see in a lumbar vertebra. Moving upward, transverse processes of the thoracic vertebra have an articular facet for ribs, as do the vertebral bodies, sometimes one or two, depending on how many ribs they're sharing. The spinous processes are very downwardly directed, especially in the middle part of the thoracic vertebra. And the vertebral bodies are kind of in middle in terms of how substantial and stout they are. So let's take a rib and just take a very close look here at how it articulates with both the body of the vertebra and its transverse process. So the ribs each has a head just here, a neck, and a tubercle. And that tubercle is going to be where it articulates with the transverse process of a vertebra, and the head will be where it articulates with the vertebral body. The inferior side of each rib has a little groove. It's a little tough to see here, but this groove on the underside, or costal groove, is going to be where a group of vessels and nerves run, and that groove is there to protect them. Anteriorly, the ribs end in cartilage, which will articulate with the sternum, as we mentioned before when we looked at the skeleton. The first and second cervical vertebra are very unique, so we'll just kind of scooch these out of the way and look at what's a little more typical for C3, C4, C5, C6, and C7. So these are in the upper part of the vertebral column, so they don't bear a great deal of weight. So the vertebral bodies tend to be pretty small in comparison to some of the others. They tend to have bifid or split spinous processes here. And the transverse process has this hole in it called the foramen transversarii, where a large vessel supplying the brain is going to be traveling. Now if we take a look on the anterior view, another characteristic of these cervical vertebra is that they have these lips on the upper lateral side of each vertebral body. These are called uncinate processes, and they help keep the vertebra from moving too violently across from one another so that the head remains stable. So now that we've seen the generic vertebra, let's take a look at C1 and C2. C2, second cervical vertebra, is also known as the axis, and C1 known as the atlas because it supports the skull. C2 has most of the characteristics of a cervical vertebra, bifid spinous processes, but it has this big thumb-shaped extension going superiorly. That is called the dens, or the odontoid process. And it is going to actually articulate with the atlas just above it. So let's get those two together there. It's using that pivot point to move and to rotate from right to left. Now, point of fact, that odontoid process is there because C2 actually stole the vertebral body from C1. And that's why C1, well, one of the reasons it looks so strange is because it doesn't really have a vertebral body. It has an anterior little kind of extension right here, protuberance anteriorly. It has two lateral masses instead of full transverse processes, and it has a posterior arch and a posterior prominence just there as well on that arch. Note it's got an articular surface here for C2 for the axis, but here it has what's an articular surface where it's going to have the occipital condyles, or the underside of the skull, resting. As we